Hi, everyone, and welcome back to another episode of hashtag See Arthritis. I'm here in the studio with Dr. Zahi Touma. So, welcome to the program, Dr. Touma.
Thank you. And really, it's a pleasure to be again with you.
Well, it's our pleasure and honor, trust me. I'm going to tell the audience a little bit about you, Dr. Touma. Dr. Touma is a rheumatologist and clinical epidemiologist. That means he's really good at numbers. At the University of Toronto and University Health Network, whose research is focused on patients with systemic lupus erythematosus, or you hear it called SLE, and the measurement science with a particular interest in the assessment of disease activity, patient-reported outcomes, and cognitive function. So what the disease is doing, what patients tell you are happening in them, what you're seeing, and also how their mental health is and cognitive function. So we're going to talk to Dr. Touma about a workshop that he was a part of at this year's meeting. And the workshop titled Dr. Touma's Best Practices for Cardiomyopathy Monitoring in Antimalarials Use in Systemic Lupus Erythematosus. So basically, what are the best ways to monitor people and cardiomyopathy heart when they're on an antimalarial? That's sort of a lay way of putting it. You can refine that if you will. So first, we're going to start with the basics. Please tell our audience, Dr. Touma, how you found yourself as a young whippersnapper in medical school, how you gravitated to rheumatology, and then in particular, what honed your focus on lupus and epidemiology.
Yes. This is a very common question. Often people ask us, but I think majority of us as rheumatologists, we link our choice to our passion and love to internal medicine.
Ah,
Because really rheumatology, it's in general involves a lot of organs and it has a lot of internal medicine in it. So you cannot be a rheumatologist if you don't have the passion to look after all organs and take care of this. And particularly with systemic lupus, or if we're going to say, as you said, SLE or lupus, multiple organs can be involved. And you have to monitor not just only the skin and the joints, you need to look after the organ where often it doesn't hurt. Something like the kidney, when you have inflammation in the kidneys or other part of the body. So really that was kind of behind my decision is again, the passion toward internal medicine.
it's interesting you say this, Dr. Tuma, because I just interviewed Dr. Michelle Batiche, who you probably know, a pediatric rheumatologist, and she said literally the same
Yeah.
thing. The profession is a bit like a jigsaw puzzle. You've got to be good at putting puzzles together.
Absolutely right. Absolutely.
Yeah,
And
yeah.
the challenge with our systemic diseases is always you don't have the pieces of the puzzle present at the same time. And sometimes you have to wait a year or two and then say, aha, I did have this and this. Let's put things together and I have a diagnosis at the end.
Yeah, and some of those pieces are turned over on their face, so you can't
Yes.
even see the
No,
picture. You just see the shape, maybe.
exactly.
That's fascinating. So tell us, Dr. Tuma, your workshop, or you're part of a workshop. I gather there were a few other abstracts that
Absolutely.
were presented as well, but yours focused on cardiomyopathy monitoring when people are on antimalarials, such as hydroxychloroquine. Most or Plaquenil, most patients who are tuning in would know it that way. So tell us about the why. Why is this such an important piece of work to be talking at in this kind of venue in a
Yeah.
workshop with your colleagues?
Absolutely. First of all, I want to thank the CRA for allowing us to have this workshop, which is very important, as you mentioned. And also, I want to acknowledge Dr. Paula Harvey, who's a cardiologist at the Women's College Hospital, and she's been instrumental since we started doing this at the hospital here at the clinic. In addition, Dr. Sasha Bernatsky joined us
Yes.
on this effort at the workshop. And also, I don't want to forget Dr. Arij, who's a fellow with us and did really a lot of heavy lifting to have such a successful workshop based on what we've heard from the people feedback and the patient as well. So this is a very important topic because antimalarial medication or hydroxychloroquine, and if it's okay to refer to it as Plaquenil, because this
Sure.
is currently what we use.
Yep.
Plaquenil is a very important medication for lupus. It's the first drug that we recommend, and often it works very well for patient, okay? And we know if you taper it or stop it down the road, there is a beautiful Canadian study that taught us that the patient go on and flare. So we know how important it is, okay? And no matter what I'm gonna say today, we have to be very clear. We're not trying to scare people, and we want to continue to say that Plaquenil is a very important medication for patients with lupus that they should be maintained on it, okay? But what is important to learn is how do we screen for possible adverse event or complication that can happen with any medication. But here we're talking particularly about Plaquenil. Often, always our patient, when they start Plaquenil, we do baseline eye assessment, exam, and we do every year an eye exam. So the same way we have learned how to monitor and screen for retinal toxicity or complication that can happen in the context of Plaquenil toward the eyes, we have to learn also that the heart in some patients, very rarely, but there is something that can happen. You mentioned it, it's called cardiomyopathy, which means, bottom line, the plaquenil can deposit at the level of the muscles of the heart, and with time, it can affect the functionality or the function of the heart, which can give the patient sometimes difficulty breathing and other manifestation. So again, really here, the key is screening for this and recognizing that something can happen.
Yeah.
Okay?
Yeah. And so to your point about this possibly scaring people, it's actually quite the opposite. This type of work is
Yes.
to assure safety, right? And which is comforting to people like me. You mentioned, the possible toxicity to the heart. Is this true in other? I know your focus is on SLE or lupus, but other types of um, autoimmune arthritis, also the people who have it take this medicine. Is that true across autoimmune forms of arthritis?
So, I want to mention again that from our center here, particularly in almost 5, 6, 7 years ago, Dr. Murray Ruiz, Dr. Daphna Gladman, along with Dr. Paula Harvey and Dr. Konstantinos Tselios, who's now at staff at McMaster, really did beautiful work at that time, and we learned a lot from this. And they conducted as well a systematic review to look outside even lupus, as you mentioned, rheumatoid arthritis and Sjogren and other diseases. And what we have learned until now, that this is not just only limited for lupus, for
Okay.
systemic lupus. Really, all other diseases, when patients are taking antimalarial Plaquenil or chloroquine, we should be careful and monitor the heart. We're
Okay.
doing now a new systematic review to see if things have changed, if we have new evidence to learn around this. But as you mentioned, and we said it during the workshop, this is not only limited for lupus. And you can see in the literature that there have been cases reported around cardiomyopathy, not just only in lupus, also in rheumatoid arthritis patient and other immune and autoimmune diseases.
Yeah. So just to reinforce, though, for people who are living with one of these diseases or conditions, that these types of studies are to assure safety as you're on them.
Exactly.
Yeah.
And thank you again for saying this, because really what we want the message to say again here, or to be delivered, that there is no doubt this is a very important medication. Just we have to learn how to screen for very rare complication that can happen. That's all
Right.
what we're.
Right. That's fantastic. And so we kind of, my next question to you is, what was the benefit of the workshop when you sort of, if people with lupus, for example, were able to sit in on your workshop, what do you think the direct benefit to them
The direct
was and
benefit.
is?
Yeah, the direct benefit is it's kind of we're learning about something important that we can't ignore it, right? And it's always important to screen for potential harm from any medication we're taking. And in this situation, we learned that annual screening is important when we take Plaquenil.
Yeah. Yeah. I think to the audience, Dr. Tuma, these studies, in my view as a patient, this is a very simplistic view, but probably one that's shared out in the audience and very practical, is we sit in the clinic with you, for example, if you're my treating rheumatologist, and I'll ask the question, will this hurt any of my organs? Well, with this body of work, you're able to say in a generalized way, this is what we know. You can give patients definitive answers. I think this is the beauty of the research that you and all of your colleagues here in Canada are doing. It's to offer fact-based answers to the very questions we walk into your clinic with.
You're absolutely right. And medicine, you always learn and continue to discover new things that guide us on how to help patient and manage patient journey.
Yeah.
And what we have learned here in this situation that there is some screening lab test, blood test that we do, troponin particularly, muscle enzyme CK, and something called BMP. But particularly, we're finding that actually troponin is the most useful test. And if you do this on a yearly basis, you will be able to pick up really on very early changes or subtle changes before they become problematic or even before anyone would ever feel it. So
Right.
this is really the whole idea, prophylactic screening measures before we end up with a problem where we cannot go backward, kind of.
So prevention, it's a
Prevention.
preventative
Yeah.
measure. Yeah. Tell us, Dr. Touma, you know, this was the perfect theme given the meeting was in Halifax, but the theme of the meeting was shifting tides, embracing change in rheumatology. So you're an epidemiologist. You're used to studying big populations. I said at the beginning, kiddingly, but it's true. You guys are really good at math as a result, and you know how to model data so that you get these quality answers. When you think about lupus and the field of epidemiology, and you think about these shifting tides and changes in rheumatology as it relates to this area of study, what do you see kind of on the near horizon? You mentioned this
Yeah.
test. Is there some other way of change happening, change that I might be able to impact as a patient, change that we can impact together,
Yeah.
or you can impact in your clinic?
Yeah. So, in addition to the workshop that we have mentioned and what we said about Plaquenil, I want to talk as well about the significant paradigm change that's happening for lupus and lupus patient particularly. So, if we remember and we go back with the history with the rheumatoid arthritis, probably 20 or 30 years ago, when we got introduced to the biological therapy, anti-TNF at that time, and we know how this changed people's life and the way we manage rheumatoid arthritis and at the same time psoriatic arthritis and ankylosing and many other diseases. Finally, this is happening in the world of lupus. And new biological medication are getting approved, the one after the second, which is amazing, really. And at this level, we have on the market at least two or three biologic available for lupus. But really, the pipeline is so busy, and that's great. And we're hoping if we continue to have positive trials, maybe if you interview me in a few years from now, two or three, we might have another two, three molecules on the market. And
Yeah.
this is great because there is a huge unmet need for the management of patient with lupus. And it allows us to stay away or to avoid the chronic use and the reliance on glucocorticoids or prednisone or steroids, because we know the potential and the high risk of adverse event that the patient has to pay down the road if we rely too much on prednisone.
Right.
So
Wow.
that's
This
really good
is
news.
so exciting. And I was gonna ask you this off camera, but maybe I'll put the serious pressure on you and say, will you come back and talk to us specifically about these new therapies?
Absolutely. I'm happy
Yeah.
to do this. And we're all excited really that we have new medication to offer to our patient.
Yeah, that's fantastic. Okay, you heard it there, folks. I've got his commitment to come back to talk about new and emerging therapies in lupus. So, Dr. Touma, we cannot thank you enough. This has been so interesting. I think hopefully it gives assurance to people at home who are watching, who are living with lupus, that your colleagues across the country are really being vigilant about doing work around organ impact when we're taking these medicines. Some of us for life. I mean, I've been on methotrexate for 36 years, and because I've enrolled in studies such as you do, they've been able to monitor, and I've taken it safely for that long. So super appreciate all that you do. I know you've got a hugely busy clinic day. We appreciate so much you taking the time, and just know our audience thanks you as well. So until next time, Dr. Touma, We thank you. And to our audience, we thank you for tuning in. And please check back on the hashtag C Arthritis channel because we will be coming back to you with another episode very soon. Bye for now.
Bye bye. Thank you.